Have you ever thought of your nose as a health monitor? Most of us take our sense of smell for granted, only noticing it when we catch a whiff of something delicious or unpleasant. But what if I told you that your nose is actually one of your body's most sensitive and reliable warning systems? It's constantly working in the background, picking up subtle changes in your environment and even in your own health, often before you notice any other symptoms. It's more powerful than you might realize. Your sense of smell is not just about enjoying the aroma of fresh coffee or a blooming flower. It's a complex system that connects your nose directly to your brain, influencing your emotions, memories, and even your behavior. Every time you breathe in, your nose is analyzing the air for information that could keep you safe and healthy. Beyond enjoying pleasant aromas, our sense of smell acts as a silent guardian, closely tied to our overall health. It helps us detect dangers like smoke, gas leaks, or spoiled food, protecting us from harm. But its role goes even deeper. Scientists have discovered that changes in our ability to smell can be one of the earliest signs that something is wrong inside our bodies, long before other symptoms appear. Recent research reveals that a decline in smell can be an early warning sign for over 130 diseases. This includes serious conditions like Alzheimer's, Parkinson's, and even some types of cancer. In fact, doctors are now paying closer attention to changes in patients' sense of smell as a valuable clue in diagnosing and monitoring these illnesses. It's a fascinating and rapidly growing area of medical science. This challenges us to pay attention to changes in our olfactory abilities. If you notice that familiar scents seem faded or missing, or if you suddenly lose your sense of smell, it's important not to ignore it. These changes could be your body's way of signaling that something deeper is happening, and early detection can make a big difference in treatment and outcomes. Imagine your sense of smell as a smoke detector for your body, often the first clue that something is wrong. Just as a smoke detector alerts you to danger before you see the fire, your nose can alert you to health issues before you feel sick. It's a built-in alarm system that deserves our attention and care. Because the olfactory system is directly linked to the brain, its health can mirror our central nervous system. When the pathways that carry smell signals are disrupted, it can be a sign that the brain itself is being affected. This is why neurologists and other specialists are increasingly using smell tests as part of their diagnostic toolkit, especially for older adults or those at risk for neurological diseases. In this video, we'll explore why smell is vital, how its decline signals disease, and what you can do to protect it. We'll look at the science behind your nose's amazing abilities, share tips for keeping your sense of smell sharp, and explain when you should seek medical advice. Whether you're curious about your own health or caring for a loved one, understanding the power of smell can help you take charge of your well-being. It's time to give your nose the respect it deserves. It may hold the key to a healthier future. By learning to listen to what your sense of smell is telling you, you can unlock new ways to protect your health, detect problems early, and enjoy life's rich tapestry of scents to the fullest. Our sense of smell is a powerful, yet often underappreciated force that shapes nearly every aspect of our daily lives. From the moment we wake up and catch the aroma of fresh coffee or blooming flowers, to the comforting scent of home at night, smell weaves itself into our emotions, memories, and even our sense of safety. It's a silent guide, influencing our moods and decisions in ways we may not even realize. A single scent can instantly transport us back in time, unlocking vivid memories and emotions. The smell of a loved one's perfume, a favorite meal, or even a childhood home can evoke nostalgia and comfort. This is possible because the olfactory bulb, which processes smells, is directly connected to the brain's emotional centers, such as the amygdala and hippocampus. At the same time, our sense of smell acts as an early warning system, alerting us to danger, like the sharp scent of smoke or gas, often before we consciously register the threat. Smell is a vital survival tool. It warns us of fire, gas leaks, or spoiled food, helping us avoid harm and make safe choices. In the kitchen, a quick sniff can tell us if milk has gone sour or if leftovers are still safe to eat. For firefighters and first responders, the ability to detect smoke or chemicals can be a matter of life and death. Our noses are constantly on alert, protecting us in ways we might take for granted. Beyond safety, smell is essential for enjoyment, especially when it comes to food. Much of what we perceive as flavor is actually aroma. When we eat, our sense of smell works together with taste to create the full experience of a meal. That's why food seems bland when we have a cold or stuffy nose. The aroma of freshly baked bread, sizzling spices, or ripe fruit can make our mouths water and turn a simple meal into a memorable event. When our sense of smell fades, as it often does with age or illness, food loses its appeal. Meals become bland and unappetizing, which can lead to poor nutrition and even weight loss, especially in older adults. This loss can affect not just physical health but also emotional well-being, as the pleasure of eating and sharing meals diminishes. Smell also plays a subtle but important role in our social lives. It helps us bond and connect with others, from recognizing loved ones by their scent, to feeling comforted by familiar environments. Pleasant smells can make social gatherings more enjoyable, while unpleasant odors can have the opposite effect. Our sense of smell even influences attraction and the way we form relationships, often without us realizing it. When smell is lost or diminished, it can lead to feelings of isolation and loneliness. The absence of familiar scents can make people feel disconnected from their surroundings and loved ones, impacting psychological resilience and overall quality of life. This loss is more than just an inconvenience. It can have profound effects on mental health and social engagement. Professor Carl Philpott, a leading expert in olfactory research, emphasizes that smell is crucial not only for social well-being, but also for cognitive function. Studies show that a healthy sense of smell is linked to better memory, sharper thinking, and even early detection of certain neurological conditions. Protecting and nurturing our sense of smell is vital for maintaining both mental and physical health. Our sense of smell is far more than just a way to enjoy pleasant fragrances. It's a cornerstone of a healthy, connected, and fulfilling life. By appreciating and caring for this remarkable sense, we can enrich our experiences, strengthen our relationships, and safeguard our well-being for years to come. Imagine if your nose could do more than just help you enjoy the aroma of fresh coffee or blooming flowers. What if it could actually warn you about your health, long before you notice any other symptoms? This idea, that your sense of smell can act as an early warning system for illness, might sound surprising, but it's now gaining strong support from the scientific community. Recent studies have shown that changes in your ability to smell can be one of the first signs that something is wrong in your body. Scientists are now using advanced technology and brain imaging to understand how the sense of smell is connected to overall health. In fact, researchers often refer to the olfactory system as a canary in the coal mine for our health. Just as miners once relied on canaries to detect dangerous gases, doctors now see smell loss as an early indicator that can appear before any other symptoms of disease. This means that your nose might be alerting you to hidden health problems, sometimes months or even years in advance. A diminished sense of smell isn't just a minor inconvenience. It's been linked to at least 139 different medical conditions. These range from common issues like sinus infections to more serious neurological disorders such as Parkinson's and Alzheimer's disease, as well as certain inherited diseases. For many people, losing their sense of smell is the first sign that something more serious may be happening in their body. The reason for this connection lies in the anatomy of the olfactory system. Olfactory nerves are actually an extension of the brain itself, reaching out into the environment through the nose. Because they're so exposed, these nerves are especially vulnerable to damage from toxins, infections, and even age-related changes. When these nerves are damaged, it can signal deeper issues within the brain, or elsewhere in the body. That's why smell loss is now recognized as a powerful early warning sign, one that shouldn't be ignored. It can help doctors catch diseases at an earlier, more treatable stage. Because of this, experts are now recommending that routine smell screening become as common as vision or hearing tests. By checking our sense of smell regularly, we can catch potential health problems early, giving us a better chance to treat them before they become serious. Smell loss isn't all or nothing. Anosmia is total loss. Hyposmia is partial. Anosmia can be isolating and dangerous. Imagine missing the scent of smoke or spoiled food. Hyposmia is more common and often gradual, making it easy to overlook. There are also distortions like parosmia, where familiar smells become unpleasant, and phantasmia, where you smell things that aren't there. These conditions highlight how delicate our olfactory system is. The type and speed of smell loss can offer clues. Sudden loss may signal infection or injury, while gradual decline can point to aging or neurodegeneration. Describing these changes to your doctor can be a key diagnostic tool. Smell loss can result from many causes, from temporary to serious. Viral infections like colds or COVID-19 can block or damage olfactory neurons, sometimes causing lasting loss. Chronic sinus issues such as rhinosinusitis or nasal polyps are major culprits. Allergies, smoking, and exposure to chemicals also harm the olfactory system. Head injuries can abruptly sever olfactory nerves. Aging naturally reduces smell, but rapid or severe loss in older adults should never be ignored. Any sudden or unexplained change in smell warrants medical attention. Smell loss is a powerful early sign of neurodegenerative diseases like Parkinson's and Alzheimer's. In Parkinson's, over 90% of patients lose their sense of smell years before motor symptoms appear. This is due to disease processes starting in the olfactory bulb. Alzheimer's also affects smell and memory regions early on, making smell tests a potential tool for early detection. Identifying smell loss could allow for earlier intervention and lifestyle changes. While there's no cure yet, early diagnosis can help slow disease progression. Paying attention to smell changes could be the first step in protecting cognitive health. Caring for your nose is as important as brushing your teeth or checking your vision. Avoid irritants like tobacco smoke and wear masks when exposed to chemicals or dust. Keep your home's air clean and stay hydrated to maintain healthy nasal passages. Use a humidifier in dry environments to prevent irritation. If you notice sudden or persistent smell loss, consult a doctor promptly. Early treatment of nasal issues can prevent long-term damage. Simple habits can help preserve your sense of smell and overall well-being. One of the best ways to maintain nasal health is with a sinus rinse. Use a sterile saltwater solution. Boiled, distilled, or store-bought water is essential. Mix non-iodized salt and bicarbonate of soda into the water. Use a squeeze bottle or neti pot, tilt your head, and gently flush each nostril. This washes away mucus, allergens, and debris, reducing inflammation. Regular rinsing, once or twice daily, keeps your nasal passages clear and healthy. It's a simple routine that can make a big difference in your sense of smell. In a world focused on sight and sound, smell is often overlooked, but it's vital for health and safety. Smell loss is linked to over 130 diseases, making it a crucial health indicator. We need to treat changes in smell as legitimate health concerns. Encourage friends and family to seek help if they notice a decline. Simple habits like sinus rinsing can empower you to protect your olfactory health. A strong sense of smell enriches life, from savoring food to connecting with others. Pay attention to your nose. It's a built-in diagnostic tool. By caring for it, you're investing in a healthier, more vibrant future.